Welcome you all to RX Medicos. From today we are going to start the topic of the lower limb from our anatomy subject. So before going ahead, we are first deal with the nerve supply of the lower limb, whether we are talking about the thigh, leg or the foot region. To know about the nerve supply, we have to first know about the lumbosacral plexus. So what is plexus means? So plexus simply means the collection of nerve. Plexus simply means the collection of nerve. When we talk about the collection of nerve, it simply say as plexus, and the collection of nerve that is arises from the lumbar region and the sacrum region of the vertebral column is known as the lumbosacral plexus. In this diagram, it is clearly mentioned that these are the nerves, these are the various branches of the nerve that is arises from the lumbar region and the sacrum region of the vertebral column. Okay, now we are going to discuss about the branches of the lumbosacral plexus. So when we talk about the branches of the lumbosacral plexus, there are 5 branches of the lumbosacral plexus, and the 5 major branches we have mainly discussed about the major branch. Okay, so 5 major branches of the lumbosacral plexus are: first one is the obturator nerve, second one is the femoral nerve, third one is the tibial nerve, fourth one is the common peroneal nerve, or we can also say at the common fibular nerve. Okay, and we discuss all the nerve one by one in detail, actually which muscle of the thigh, leg or the foot region is supplied by this muscle in detail in the separate video. Here we are going to discuss about the 5 major branch of the lumbosacral plexus. That one is the obturator nerve, femoral nerve, tibial nerve and the common peroneal nerve, which is the most common nerve of the lower limb that is more prone to injury. Okay, and the common peroneal nerve is further divided into 2 parts. That one is the first one is the superficial common peroneal nerve, and second one is the deep peroneal nerve. Okay, the first one is the superficial peroneal nerve, or we can also say as the superficial fibular nerve, and second one is the deep peroneal nerve. So basically these are the 5 nerves: first, second, third, fourth, and we are basically talk about the fourth A part and the second part. They are collectively the major nerves of the lumbosacral plexus that supply to all the parts of the lower limb, whether we talk about the thigh, leg or the foot region. Okay, now we are going to discuss about origin, from where, what is the root value from where these all 5 major nerves are arising from. We had seen here they are arises from the lumbar region and the sacral region, from which root value they are arising. We are going to see about that. Okay, now moving ahead, we have 5 lumbar vertebra: L1, L2, L3, L4 and L5, S1, S2 and S3, and there is both we have the anterior division and posterior division. Anterior division and second one is the posterior division. And from both, whether we are talking about the anterior division or the posterior division, from both the nerves are arising. From the anterior division of L2, L3 and L4, and from the posterior division of L2, L3 and L4. From the anterior division of L4, L5, S1, S2 and S3, one nerve is arising. From the posterior division of L4, L5, S1 and S2, Also there is one nerve is arising. Now which nerve is arising from which division? Now we are going to discuss about that one. From the anterior division of L2, L3 and L4, the obturator nerve is going to arise. Obturator nerve is going to arise. From the posterior division of L2, L3 and L4, the femoral nerve is going to arise. And from the anterior division of L4, L5, S1, S2 and S3, the tibial nerve is going to arise. And from the posterior division of L4, L5, S1 and S2, the common peroneal nerve, or we can say the common fibular nerve, is arise, which further divide into the superficial peroneal nerve and deep peroneal nerve at the near the neck of the fibula, and where these nerves are more superficial, that's why it is more prone to injury. So we say that the common peroneal nerve is the most commonly injured nerve of the lower limb, and one clinical aspect is also related to it, that is the foot drop, that we discuss in the later on video. Okay, now we have seen that the root values of this nerve, we have to not mug up all these things, we have to just simply remember from the diagram, not put such a hard effort to remember all these things. And to summarize all these, I had made a mnemonics for you all guys. What is the mnemonics here? OT may fee come. When we are talking about the concession of fee, we have to go through the back door, or back door means the posterior side. So from the posterior division, the fee come, femoral nerve and the common peroneal nerve is going to arise, and from the anterior division, the obturator nerve and tibial nerve is going to arise. So that is the basic simple mnemonics made by me for you guys, so that the all things become separate, not be mug up with all these things. Okay, now we are seeing here one thing, that when we talk about the L4, when we talk about the L4 contribute L4 when we talk about L4 contribute in the formation of all the nerve, whether it is the obturator nerve, whether it is the femoral nerve, whether it is the tibial nerve, or whether it is the common peroneal nerve. That's why all L4 is called as the nervus furcalis. What we say to the L4? We say L4 as the nervus furcalis, because it contribute in the formation of all the major nerve of the lower limb that we are discussed here. Okay, so that is the note point that we have to remember from here. Okay, now we have to also remember a small concept here about the sciatic nerve. For sciatic nerve we have separate video, but when we are talking about the tibial and common peroneal nerve, I think so to just give a superficial view to you regarding the sciatic nerve. What is sciatic nerve? So sciatic nerve, it is basically a sheath that encloses the tibial nerve and the common peroneal nerve, and it is the sheath that encloses the tibial nerve and the common peroneal nerve, and at the upper part of the fibula the sheath get removed, and from where these all two nerve became separated, in which the common peroneal nerve lies laterally and the tibial nerve lies medially. Okay, so what is sciatic nerve? So sciatic nerve, it is a basically sheath that encloses the common peroneal nerve and tibial nerve in the posterior compartment of the thigh, that get divided into the tibial nerve and the common peroneal nerve, in which common peroneal lie laterally and tibial lie medially at the upper part of the popliteal fossa, which is a diamond shaped depression present on the back of the knee, which we discuss in the further video. Okay, and when we talk about the origin of the sciatic nerve, so we have to not mug up all these things, not have to remember, just see from here. It is made from the tibial nerve and the common peroneal nerve. So what will be the origin of tibial and common peroneal nerve? That will be the origin of our sciatic nerve. L4, L5, S1, S2 and S3. basically from L4 to S3, that is the origin of the root value of the sciatic nerve. Okay, now we are going to discuss about the nerve supply. Moving ahead, and we are going to discuss about the nerve supply of the thigh. So in thigh, the muscles are arranged in the form of compartments, in the three compartments. And which one? First one is the anterior compartment, second one is the posterior compartment, and third one is the medial compartment. And in the medial compartment of the thigh, all the adductor muscle are present. Anterior compartment. In the thigh, the muscles are arranged in the form of compartment. In the leg as well, the muscles are arranged in the form of compartment, in the form of anterior compartment, posterior compartment, and lateral compartment. But when we talk about the foot region, in the foot region, the muscles are not arranged in the compartment, they are arranged in the form of layers, and 4 layers. Muscles are arranged in the 4 layers in the foot region, and it is supplied by the which nerve? So when we talk about the foot, it is supplied by the tibial nerve, and the tibial nerve at the flexor retinaculum. In the ankle region, it further divided into the medial and the lateral plantar nerve. Okay, medial and lateral plantar nerve. Okay, now we are going to discuss about the nerve supply of the thigh. Anterior compartment. So anterior compartment of the thigh is supplied by the femoral nerve. The posterior compartment, whether it is of the thigh or the leg, it is supplied by the tibial nerve. In the leg, it is also supplied by the tibial nerve. And the medial compartment is of the thigh is supplied by the obturator nerve. And the anterior compartment of the leg is supplied by the deep peroneal nerve or deep fibular nerve. Deep peroneal nerve. And the lateral compartment is supplied by the superficial peroneal, or we can say that the superficial fibular nerve. So these are basically the overview of the nerve supply to the all the compartments of the lower limb, whether we are talking about the thigh region, leg region, and the foot region. We had also made a chart here which discuss about the posterior anterior division, all the nerve arising from that division and their root value we have discussed already. Okay, and we have 2 note point here. We have to remember nervus furcalis. I had already told you regarding L4 is referred to as nervus furcalis because it contribute in the formation of all the muscle, and the sciatic nerve is nothing but is a sheath enclosing tibial nerve and common peroneal nerve, in which the tibial nerve lies medially and the common peroneal nerve lies laterally, and at the upper part of the popliteal fossa it divides into the tibial and the common peroneal nerve. That's all about the lumbosacral plexus and the nerve supply of the lumbosacral